alcohol, NAFLD, hepatitis B/C, certain medications, genetic, autoimmune hepatitis, blocked or damaged bile ducts, metabolic syndrome, exposure to toxins, toxic hepatitis, parasitic. Hello everyone, welcome back to our channel. In my today's video, I will discuss what liver cirrhosis is, and what factors contribute to the development of liver cirrhosis. So, stay tuned as I tell you the 10 major causes of cirrhosis if left unchecked, can turn into a life-threatening liver failure. Okay. So let's first understand what cirrhosis is. Liver cirrhosis is a chronic liver disease that develops due to the scarring of the healthy liver tissues. How does your liver get scarred? Scarring happens when your liver repeatedly repairs itself from the damage of excessive alcohol consumption, or certain infections. These scar tissues develop on the liver, and if your liver remains unchecked, then this scar formation can lead to further liver complications such as jaundice, hepatic encephalopathy, etc. Well, liver diseases are common nowadays and the 11th leading cause of death worldwide. You might be shocked that approximately 1.5 billion people have chronic liver disease globally. This is seriously a big number, and I think it needs to be addressed cautiously. Well, nonetheless, liver disease are spreading across the globe and affecting people in a record number. Let's discuss the causes of liver cirrhosis. The first and most prevalent cause of liver cirrhosis is excessive alcohol consumption. Yes, alcoholic liver diseases are more prevalent in the population. Intake of alcohol for a longer time can severely affect liver functions, and subsequently, your liver gets damaged. Your liver breaks down the alcohol, but when you drink it in excess, your liver becomes overloaded and can't process it efficiently, leading to liver inflammation and then scarring. Okay, I will give you data that concludes how common it is to develop liver cirrhosis from alcohol intake. Approximately 10 to 15% of people with chronic alcohol abuse develop cirrhosis. Even 46% of liver disease deaths are reported in people with alcohol intake. So, alcohol abuse is one of the leading causes of cirrhosis worldwide. Now, I will talk about the second cause of liver cirrhosis, which is not even linked to alcohol. It is non-alcoholic fatty liver disease, NAFLD. Yes, your liver may also get damaged by factors other than alcohol. Fatty liver disease develops when fats get stored in your liver, making it inflamed. It is often linked to type 2 diabetes, obesity, high cholesterol, and other metabolic disorders. If you leave this condition untreated, then it may turn into liver failure. Again, I start with the third and most important cause of liver damage is hepatitis B and C viral infections. Hepatitis virus, be it B or C, targets the liver and causes inflammation. If it is left untreated, it may progress to liver cirrhosis or liver failure. Between the two of them, hepatitis C is more dangerous as it remains asymptomatic until significant liver damage happens, whereas hepatitis B can be more common in the population where proper vaccination is not done. So, you should get a timely lab test done to avoid any severe infection from any kind of hepatitis virus strain. The fourth cause is the use of certain medications or drugs over a long time. Yes, many times we often misuse certain medications such as over-the-counter drugs, NSAIDs, antimalarial drugs, antibiotics, etc. These medicines can interact with the liver enzymes and thus slow down liver functions. If you continue taking these medicines for a longer time, then this can cause severe liver damage or even liver failure. Well, do you know that some autoimmune conditions may also trigger liver failure? Yes, autoimmune disorders can also cause damage to your liver. In an autoimmune disorder, your immune system mistakenly attacks the healthy liver cells, identifying them as foreign cells, and thus causes inflammation and finally leads to liver cirrhosis. We also call this condition autoimmune hepatitis. Some genetic disorders can also contribute to the development of liver cirrhosis. Yes, I give you two examples of how genetic disorders can cause liver failure. The first example is hemochromatosis. In hemochromatosis, your body absorbs too much iron from the food, and the excess iron gets stored in the liver. This causes severe damage to your liver and leads to liver failure. Another example of a genetic disorder that can harm your liver is Wilson's disease. It is a condition when excess copper starts accumulating in your liver and other organs, leading to liver inflammation and later on liver failure. So make sure if you have these kinds of genetic disorders, then your liver is at risk of developing cirrhosis. Next, I will discuss the rare but important cause of liver cirrhosis is bile duct disease. It can be a rare factor but can't be ignored because these bile duct diseases harm your liver to an extent. You know that bile is important for your digestion as it helps in fat emulsification and carries waste from the liver. This bile is carried from the liver to the gallbladder where it is stored and reaches the intestine through the bile duct when required. In case this bile duct gets damaged or blocked, then bile will start accumulating in the liver and resulting in liver cirrhosis over time. Okay, I tell you two common bile duct diseases. One is primary biliary cholangitis (PBC), where your immune system attacks the bile duct. And another is primary sclerosing cholangitis (PSC), which causes inflammation and scarring of the bile duct. Well, these conditions are rare but can affect the liver if left untreated. Your surrounding plays an important role in deciding your overall quality of health and life. Yes, the next cause I am gonna tell you is related to which kind of surroundings you live in. Yes. Environmental toxins can also contribute to cause liver damage. If you are exposed to pesticides, insecticides, cleaning agents, and toxins from industrial waste for a longer time, then you may be at risk of developing liver cirrhosis. These toxins start storing in your liver and cause toxin hepatitis, which eventually leads to serious liver failure. Chronic heart failure can indirectly cause liver damage. Yes, it is common in people who have chronic heart issues where the heart does not pump the blood effectively and blood remains in the liver, leading to congestive hepatopathy. This raised blood flow in your blood vessels can cause damage and scarring, leading to liver cirrhosis. Now, the 10th and last, some parasites can also cause liver cirrhosis. Yes. Parasitic infections can also lead to liver damage. It is very common in developing countries where clean water is not available. You know, some parasites like nematodes, protozoa, cestodes, trematodes, etc. can cause liver diseases. I tell you a parasitic disease that can contribute to liver cirrhosis is schistosomiasis, which is caused by blood flukes when your skin comes in contact with contaminated water and leads to liver damage over time. I hope you would have better understood what can seriously put your liver into trouble. I mean, what can cause liver cirrhosis. Liver diseases, if I tell you in general, are affecting large populations worldwide, and sometimes they are easily treatable, or sometimes they become even fatal that they cause other health complications too. Well, a timely and right treatment can solve liver problems permanently. Your liver can regenerate itself in damage, but once its functions get slowed, it needs a medicine that energizes the liver to function efficiently. This can easily be achieved by the natural and holistic system of medicines. Well, don't you think it is much better to treat your disease with customized and personalized medicines that suit your system best? Homeopathy treats the patient as a whole and works on your system by considering the whole constitution. I mean the physical and psychological symptoms both. Even I have treated many patients who had liver disease and taken treatment from several clinics. But when they came to Bharat Homeopathy, I analyzed their condition and gave treatment based on their constitution. They saw a major improvement in their liver disease within just a few days, and they became liver disease free right after a few months. If you want to be free from your liver disease without side effects and want to see how homeopathic treatment can save your liver within just a few days, then you can give us a call on our number and begin your treatment regime today. I hope this video has been helpful to you. Make sure to like and share this video with others who might benefit from it, and don't forget to subscribe to the Bharat Homeopathy YouTube channel for more health-related videos. Thanks.